Hey, good morning. Can you guys hear me? Whew, I've been having all manner of issue with Zoom this morning, so I'm glad I can hear you guys can hear me because that hasn't been the case. Hi everybody, I'm Barty from the Children's Defense Fund of Minnesota. I co-chair the Prenatal to 3 Coalition, and it would be wonderful if folks could, excuse me, if folks could put their name and their introduce yourself. Sorry, there's a tuba going on. You've joined us during band, and so there's a tuba in the background. Apologies for that. And so if you all could introduce yourselves in the chat, that would be great because we have some new folks here at joining us today and some special guests. I'm going to go on mute so you don't have to hear the tuba quick. Great. Thanks, everybody. Perfect. Well, thanks for getting us started. We actually have a very full agenda today, as we usually do. We want to. Golly, sorry guys, it's so loud here. So we'll we'll get started. Laura, do you want to jump in? It's so loud here. I'm so sorry, you guys.
I am happy to jump in. And it is not loud on our end. It sounds beautiful on our end. So I'm sure it's loud for you, but for us, it sounds like you have a very talented tuba player at home. So, okay. Well, we do have, as Barty was mentioning, we have a very full and exciting agenda today. And what we wanted to do is bring forward a couple of our speakers and partners around maternal and child health priorities. Some are policy initiatives, and others are more grant focused through the state. So we're going to hear from a few different people with us today. We're going to change up the order because it is session, and we are trying to be responsive to the different needs that have emerged as committees have made final decisions and agencies have made final decisions. So we're going to change that up slightly. I wanted to just say that there are a number of maternal and child health focused bills moving forward this year, as we've talked about. And then there's a number that have moved forward through the federal stimulus bill. And I did send out a really nice summary from 0 to 3 of what's in the federal stimulus package. So if you did not receive it, as soon as I'm done talking, I'll add it to the chat again so people can see it. But these, what we're excited about from a coalition perspective is that many of the maternal and child health focused bills that are out there are looking at equity in a number of different ways. And this is something that we've been talking about since we began meeting, thinking about equity, racial equity, thinking about geographic and economic equity. I'm pleased to see a number of these moving forward. And I wanted to just say also that it's crucial as we think about this. For those of you who heard early on, we have a couple moms who have babies under the age of 1 with us today, and we do know that the life outcomes of every child take shape during the pregnancy, and then they're influenced by a whole number of dynamic experiences that people have, or that children have, and families have in those first years of life. And this is what we've been working together for over the last several years, right? Is making sure that families have the best opportunity to create experiences that are unique and powerful for their children so that they can get the best stabilizing support and thrive in the future. And so I'm super excited to be able to have with us a few different women today to talk about some of the work that they've been focusing on. And we're going to actually start with Safia Khan. She's with the Department of Corrections, and she is here today to share a little bit more about the Healthy Start Act. We heard about this last month when Stephanie Hoganson introduced some of the legislative priorities that are in the governor's bill. I also forwarded you a fact sheet on the Healthy Start Act, but we have asked Safia to join us and share more details. So I'm going to go ahead and turn it over to you.
Thank you so much, Laura. And thank you, everyone. This is obviously my first time joining you. I'm the Government Relations Director at the Department of Corrections, which means I don't get to actually be in this space very often, but this is the kind of space where I actually come from. I worked at the Domestic Violence Coalition in the state for about 10 years before I arrived here. So kind of policy around health, policy around anti-violence is where my jam's at, and I'm one of the new mamas on this call. So this is a very special bill to me personally as well. So our Healthy Start Act is something that we've been working on for about a year and a half. It has come to fruition because of advocacy of formerly incarcerated mothers who have coordinated their advocacy through the Prison Doula Project and Dr. Schlafer at the University of Minnesota. And at their urging, we had conducted a series of listening sessions with women at Shakopee and heard about a range of different issues involving their needs and the needs of the children that they have left on the outside when they are coming in. And this is one of the solutions that we are bringing forward that is more legislative in nature. We're also hoping to work on a range of internal changes and internal kind of capacity building for the department to be able to better connect and better keep connections between parents and their minor children while during the period of incarceration. So our Healthy Start Act would allow the Commissioner of Corrections to place a person who is pregnant or immediately postpartum in a community alternative for up to a year. And a community alternative could look like a residential halfway house type setting. We are in conversations with a couple of halfway houses who in the past have taken mothers and babies or mothers and minor children, but ever since have stopped doing that. They definitely plan on restarting that practice were this to become law, and the department was interested in contracting with them to be able to have beds available. So it's something that we would have to work on to create a program if this legislation passes. But the first step is really to get the legislation passed, because at the end of the day, a judge has made the decision to send someone to prison while they are pregnant. And for us to, we couldn't simply say we would not honor the sentence. We do have to carry that sentence out. But what we're asking for is for the confinement to happen in a way that could really honor mother-child bonding in that really critical period in the beginning. So that's our proposal. I know you have received the fact sheet, but I can share some of the data that we have. And I know Stephanie's on the call with me too. So Stephanie, jump in at any time. But since 2013 and 2020, we've seen 278 pregnant women sentenced to prison in Minnesota. So that's about 40 pregnant women a year. 34% of these women were Native, 12% were Black, and 53% were white. And what I found interesting when we pulled this data more recently was that their median length of stay with us was actually just 4.5 months. When we looked at average, because a few had longer sentences, the average was about 9.6 months, but median was 4.5 months. And I was just kind of looking through our spreadsheet of the individuals and saw that a lot of people actually came in pregnant and left pregnant. So their time with us was so short. And oftentimes, in 77% of the cases, they were coming in for technical violations of their supervision. Majority of those were technical violation of their probation, and some were technical violations of their parole. So meaning they had been to prison before, gone out, and then were coming back. So combined, it was 77%. 84% of them had non-violent governing offenses. And then what was kind of key for us to look at was that 41% of mothers who gave birth while they were incarcerated reached their release dates within 90 days of giving birth, and 54% within 6 months, 67% within 9 months, and 76% within 1 year. So when we looked at kind of the durations, it was just maddening. And I know anecdotally we had seen, even in the last 2 years since I've been here, folks giving birth, coming in for 2 to 3 weeks to finish up their sentence and reach that release date, and then going back out, and us not having that authority to be able to give them early release. We have other early release authorities that we're also looking at, such as work release, right? But you have to, for work release, you have to have served 50% of your time. And we fully anticipate we might do a mix and match at some point if this legislation passes. So for example, if we were to put somebody up in the community for a year through this authority, if it were to pass, and say they have a month left after that, right? At that point, they're likely going to qualify for other early releases that we have right now in statutes, such as work release. So we could also then grant them a different kind of release if it made sense to keep them in the community for that other duration. But that's our thinking around it. We worked closely with our partners at the Prison Doula Project and Dr. Schlafer at the U in figuring out the ins and outs of this process. We considered a range of options. We considered, when we started thinking about the solutions, we considered, should we bring back a prison nursery in Minnesota? And I think overwhelmingly folks thought, if we can offer that connection in the community, it is so much better than bringing children in and keeping the children in the prison as well, right? So Dr. Schlafer says it's really beautifully. I'm not being as eloquent as her, but if really the goal is to offer that connection, that should really happen outside of a prison setting, and so we are strong believers in that. A lot of other states have taken the prison nursery approach. It's also a really costly approach. And the way that I think about it is everything in prison costs a lot more, even treatment, even health services, because it comes with the cost of having security at the same time. So it's not just a doctor's visit, it's a doctor's visit while you're also, covering the cost of security in the room. Right? So it's and then overhead costs as well. So when we looked at costs, it just seems like it was a really ineffective way to solve the issue. And looking at the data, it seems like this was the approach that we'd like to take. So that's where we are. The status of the bill, it passed with a unanimous vote out of our House Public Safety Committee. We were trying to make this bill distinct this year because we actually did a lot of groundwork and brought in a lot of media attention. The Lieutenant Governor came into our to Shakopee Prison in 2019 in the fall to do listening sessions. We had a lot of media coverage, and we were ready for last session, and then COVID happened. So bringing it back, we wanted to have a strategy that would really make it distinct from a really large legislative platform that we have, and I know across the board lots of folks have. So we actually turned this into a women-only bill. So in the House, it's led by Chair Becker Finn and has the maximum number of co-authors, 34 of them, all women. We've never had as many women in the legislature, so that's really exciting that we're actually able to get that many signatures now. So it's an all-women bill in the House, and all women, and Senator Pratt, who represents the Shakopee district, which is where the prison's at, on the Senate side. So House, it passed unanimously out of committee. Senate, it has a hearing on Monday, and we anticipate it's going to pass that committee as well. I am not sure if it's going to be added to an omnibus in the Senate or not, but it's going to certainly end up on the floor at some point, is our hope. So this process will take a couple of months. We'll know more, probably around May. We are hoping it can be a standalone bill that we can just get passed, but we don't know how that's going to play out. So that's where we're sitting. And I see there's a few questions coming in the chat. So Laura, if you want, I can take those, or we can also open it up broadly for questions.
Yeah, why don't you go ahead and take what you, so it sounds like the first question actually is about the jails. So I tried to help add some clarity, but if you want to share.
Absolutely. So it doesn't apply to folks in jails because they're not actually committed to the Commissioner of Corrections. So we don't have any decision-making role over there. What I've heard from most of our sheriffs and the Sheriff's Association, who Dr. Schlafer is also working with, is when pregnant women are sentenced to jail or they're sitting there pre-trial, most often sheriffs are actually getting them furloughed because they don't feel like they have the healthcare capacity to be able to take care of them in the jails. Jails have even much less capacity than prisons do. We have a whole healthcare system inside. The healthcare system in the jails in Minnesota is really kind of varies county to county. So what we're learning is we're not seeing as many pregnant women in jail. We might be seeing women who are immediately postpartum or in that first year period. We're certainly seeing parents of minor children and mothers with minor children in jail. But for the pregnant women piece, I think it was more, they're actually being sent to prison more often by judges because they feel like their treatment needs are going to be met here, or their other programming needs are going to be met here, which is also not true all the time. We can certainly try and we prioritize, but oftentimes we have very short durations and a treatment bed might not be available right away as you come in. So certainly that is a challenge for us too.
And then, and I will follow up after. I know you have to leave early, so I will share what I know about some of the work happening in the counties for pregnant women and how the Home Visiting Coalition is working with them. But I want to give you a chance to respond to the other question. It looks like Linda is asking about breastfeeding support while somebody is in prison, and does the family, if the child is not with them, qualify for a WIC?
So I cannot actually answer the WIC question, but I can get that answer back for you. For the support for breastfeeding, so we have a partnership with the Prison Doula Project, the Ostera initiative. So our doulas actually are available to folks and do work with them to provide lactation consultancy. We also have our health services staff that works with them. We actually introduced right before the pandemic hit our lactation policy. So that would have allowed women to actually express and store and transport milk. Until this past February of 2020, we actually were not, we were able to provide breast pumps so they could keep expressing, but there was no storage or transportation available. So that was really hugely requested by many formerly incarcerated women as something that was important to them. So we did put a lactation policy in place. We looked at some other states. I think there are only 2 other states that have such a program, and we kind of copied their policy. But then the pandemic hit, and besides all the other operational issues, we actually have only had a very handful of women who are pregnant with us during the pandemic, which is good. So our numbers are inconsistent for this past year.
Safia, it looks like I misstated. So Linda, do you want to come off of mute and make sure we're actually accurately speaking?
No, so I was just wondering, interesting having a postpartum woman in a sort of halfway house in the community, since they're not actually in the prison and they're in a different situation in the community. Can that person who is breastfeeding have a WIC peer counselor?
Absolutely.
Or if a person who's incarcerated qualifies to have a WIC peer counselor, because that could be an excellent breastfeeding feeding support over and above the prison doula.
Absolutely. I think that's a really important point. We anticipate that, yes, they would be able to access that support probably a lot more readily in the community than they would in prison because of our logistics.
Mm-hmm.
But I think I'm going to make a note of this as we discuss how this program would be created and all the ins and outs of it and the mechanics of it, hopefully if this legislation passes. But that's a really important point. So thank you, Linda, for making it. I also see a question from Jane about opioid addiction. So actually I do, I don't know about cause for incarceration. So I don't know the link between Jane, between how many people are coming in for offenses specifically related to opioids, but I do know that overall, out of our entire prison population, 14% actually have an opioid use disorder. So that is either already diagnosed or diagnosed after they get incarcerated. And then when we look at the women at Shakopee, we do see huge disparities there too. It's 34% of Native women in Shakopee have an opioid use disorder. And I believe it's about 20% of all women in Shakopee have an opioid use disorder. So I don't think those numbers are inconsistent from what we anticipated. We see women having a really disproportionate impact when it comes to substance use. And then we also see for our women's population, a lot more of them, a larger percentage of them are actually in for drug-related offenses versus when we look at more of our general population. So that's also something that we are mindful of.
Great. Well, I want to just reiterate, it doesn't look like there were any other questions, but I want to see if anyone has any last questions. And while you're thinking of them and putting them in the chat or unmuting yourself, just making sure everyone is aware, we did go ahead as the coalition and offer up letters of support to the to both authors, and then have sent them forward in the committees where the bill will be heard, and trying to make connections to any of the other MCH policies that we've been supportive of, and how they are all tied together. I think that there's been a number of questions, and that's one of our discussion points later this morning, is how do all of these different MCH bills coordinate? I don't think the legislature has talked about MCH issues, maternal and child health issues, sorry, um, as often as they have this year. So it's an impressive number of bills and discussions. So.
Laura, I just wanted to say thank you for the letters of support. Thank you to each of the individual organizations and the entire coalition for the letter of support. I mean, those were really hugely important. We know it's going to matter on the Senate side too, especially with the virtual session. So I just wanted to thank you all for your support and even allowing this conversation to happen, because the reality is, from our end as a Department of Corrections, we don't, as I said, we don't operate in this policy space often. So this is not something that we were thinking very strategically about being coordinated across the board with other policy proposals coming forward. But through this process and through engagement with you all, we've actually learned of other things that is going to impact the very population who we are trying to serve as well. So the connections you all have made for us are really critical and important too. So thank you.
Yeah, thank you. I did want to just highlight, and I know you may have to leave, Safia, so go ahead and leave, but if you need to, I wanted to highlight some of the work that is happening in the counties. So the Department of Health has a grant, and the focus of the grant is to try to implement model policies in jails, in the county jails. So we have 6 counties. If I can tell you, I know 3 or 4 off the top of my head, but I don't want to miss out on them. So I will either after the meeting send them out to everybody so you have copies of that. But the focus is to really begin to even understand in the jail population. The prisons are ahead of the game here, but there are more jails across the state than there are prisons for women, whether or not you're even a parent. So they started to ask the question, are you a parent? And if so, how old are your children? So that they can help people coming into the jail, into jails, plan for how the children are going to be cared for. So it wasn't a normal part of their intake process. And now they're starting to take a look at that and better understand what resources are available. And then the other piece that I just wanted to highlight is many of you know we work closely with the Home Visiting Coalition, and the language that has so far moved through both House and Senate will allow, because of the flexible language we've added, will allow adapted home visiting services to begin, whether it's in this alternative community setting for women in prison, so if the Healthy Start Act passes, but also for jails. So we can do more of that work in a jail setting as well, because there are some counties who are leading in this space, and we want to give them as much time and attention, because I think the statistic is around 87% of all parents, whether you're a mom or a dad, will eventually go back and parent your child after leaving your time with the justice system. So we want parents to be positioned and children to have that attachment with their family. Okay, well, thank you very much. We appreciate you being here and sharing all your expertise with us.
Laura, there is some questions in the chat about, are they asking men the same question about whether they are parents?
Oh, yeah, Jane, thank you. Thank you, Bertie. Jane, I do believe that it is for everybody coming in to the jail. So they are starting to ask as an intake question, the question around parenting that just didn't exist before. So we're making good progress.
Thank you, Laura. And I know I have a hearing I have to jump off to, but I'm monitoring it on my other screen. It hasn't even started yet. So if it's okay, I'm going to mute myself and stay and just listen, and then I'll jump off when I have to. Thank you.
Can I ask a quick question, Safia, while you're multitasking there?
Yes.
I just wanted to, oh, I'm sorry, I'm super echoey, sorry. oh, is it me? God, like having every audio problem possible. I'm just curious about sort of how you think that like how you think it's going. I mean, session is always wild and woolly, and I'm just curious about like, I know that there was some, uh, the question about a hearing in the Senate and some of those different pieces, like it's always helpful for us to know how it's going, because I think then as external advocates, we can also identify pressure levers to press to maybe make some additional progress. So I guess that's just one question I have.
I think so. It's going really well. I'm actually really excited about it. I think it has a Senate hearing. Senator Limmer is giving it a hearing on Monday, and I understand he plans on passing it out of committee. I think the only thing we're a little concerned about is whether it's going to be tagged onto a broader corrections omnibus bill, which we might have things that we don't like in it too. At that time, we might, I think as this moves forward, we might be coming back to ask for some pressure, some support to get this specific policy provision passed. The House has sent it to the floor as a standalone, and we really prefer that. For now, I think, and I was speaking to Stephanie about this too, I think thanking the authors, the chief authors and the co-authors and the chairs. I mean, that's what we just really helpful. So your letters of support have really helped, but if you are in discussions with Chair Limmer, Chair Carlos Mariani, Jimmy Becker Finn, or Senator Kiffmeyer, that's just thanking them. Representative O'Neill has been a really great supporter on the Republican side in the House. So just expressing support and thanking them would be really helpful for now.
Laura, will you send us that information after the meeting, like which legislators we should thank and what we're thanking them for, like authors support, because I think a lot of us would be really interested in doing that.
Yes, we sure can.
Thank you.
Safia, there is another question in here. Barb Faber is wondering if the prisons, if the tribes from Minnesota provide any support to the prisons for their members.
I know they do around certain, so like we have religious programming and feasts, and I know that's a place where we have partnered with tribes. I don't think specifically on this issue, but this is on the radar. I know Commissioner Schnell and our tribal liaison, Randy Goodwin, had brought this up at our meeting with various tribes, and they're very interested in the policy proposal. And if this legislation passes, they intend to also be part of the discussion of how to create this program in a way that could connect efficiently a range of community supports from tribes, from community partners and service providers together to provide supports to folks as they are coming back into community essentially through this program with their children. Thank you, Barb.
Okay, great. Thank you. I'll go ahead and just introduce the next speaker then. We'll shift focus here. Great. All right, so next we are going to hear from Sarah Dunn. She is with the Minnesota Department of Health, and we've asked Sarah to come join us today to share a little bit more information about the state's grant proposal to HRSA, to the Maternal and Child Health Division. It's the Early Childhood Comprehensive Systems Health Integration Prenatal to 3 program, and help us better understand how this application will connect to some of the other work happening for integrated care for high-risk pregnancies and some of the other preschool development work that is happening across the state. So I did go ahead and send out the summary of of the aims from the grant application. We want to be really clear. It is a grant application that is being submitted. I think it's Monday or Tuesday of next week, but we still wanted to hear from Sarah what is going into the grant, and so that we can, as an advocacy community and people working with families, pregnant women and families, be better prepared to partner with the state, hoping that we get some funding, the state gets some funding. So I will turn it over to you, Sarah.
Great, thank you. I do have a couple of slides that kind of explain our goals, because they have morphed a little bit from the sheet that I sent you to send out. And so is it possible for me to share? I won't spend too long, but
I changed it so you can share.
okay, perfect, thank you. I'm gonna share. Okay. So yeah, as Laura said, my name is Sarah Dunn. I am with our Children and Youth with Special Health Needs section at the Minnesota Department of Health. I am one of the few staff that we have left who is not reassigned currently. And so I had the privilege of getting a pretty quick introduction into all of our early childhood systems efforts, and helped coordinate writing this grant application. As Laura said, it is technically due on the 15th. However, MDH has some approval processes that all of our grant applications have to go through. So actually we submitted it yesterday. It was all uploaded into our system yesterday so that it can be ready for and so that we can make sure that it's submitted on time. So the stuff I'm presenting right now is what we proposed in our application. And it's also, I give a little bit of info on who we worked with, that sort of thing. HRSA, Health Resources and Services Administration, is again the grant, the funder for this project. And they are estimated, so from what I've heard from other state partners, from other states, that they're expecting this to be a pretty competitive grant. And so they're going to be giving about 20 of them out. And so we in the past have received ECCS, Early Childhood Comprehensive Systems funding. We've received a few grants in the past. We are not a current grantee, but we're hoping to, get back in on their early childhood efforts. And so if we are funded, it will start August 1st, 2021. And so if we are funded, we would love to be able to come back to you guys and, as we're looking through our goals and that kind of thing, if there's changes we should make before we get going, we would love to have that opportunity. I will say my experience with HRSA funding and HRSA grants is that you are told that you are awarded them like a couple weeks before they're supposed to start. They're not always the greatest at letting people know ahead of time, but still we have a commitment to have this be a really community-led project if we're funded. And so we will be seeking out lots of input. So the overall purpose of the grant from HRSA's perspective is to really encourage states to do a better job integrating the health system into our early childhood efforts. And so we really saw that at MDH as an opportunity for us that we didn't want to pass up, because we do know that we've got a lot of efforts that have happened in our state in early childhood. And one kind of gap that we keep on hearing about, especially from primary care providers, is the inclusion of primary care into a lot of our current early childhood efforts has been lacking. And so we really saw this as an opportunity to kind of meet that need. And so we engaged with quite a few partners as we were developing our application, including folks from the Department of Human Services, Medicaid, interagency partnerships, child safety and permanency. We worked with folks from Minnesota Department of Education related to Part C, preschool development grant. We worked a lot with them in the development. The Children's Cabinet has submitted a letter of support for us for the grant, so they are supportive of it. We worked a lot with folks from the University of Minnesota from their Institute on Community Integration, which is our Act Early ambassador is housed there, and then the LEND program as well is housed there. And so they're all aware. I just saw Nora pop up on my screen, but we have talked a lot with the iChirp community facilitator and grantees. That's how I was connected to this meeting. And then also we've done conversations with providers, both from kind of a big perspective of like the Minnesota chapter of the AAP, but then also just through some conversations with individual providers that we have connections with at the state. So our proposed project aim that we submitted was that we really wanted to have a community-led and collected effort to develop a model for early childhood screening, referral, and follow-up in health settings that is sort of similar to the iChirp model that's done for high-risk pregnancies. And so we were really interested in how that in our conversations with DHS, they really they steered us in the direction of looking into that model as a successful one in identifying people who are the most at risk for adverse outcomes, and really having the community build how can we identify people better, and how can we get them linked to services better. And so it's sort of we sort of see our proposal as a way to continue an iChirp-like model into early childhood. And so a couple other notes about the funding. A couple slides ago, it showed the funding is about $250,000 a year, and it's for 5 years. They expect a couple of requirements of the funding is that we hire a full-time position for the grant, and that we hire family consultants for the grant. And so when we take that out, it doesn't leave a whole lot of money for other things. And so what we put the rest of pretty much all the rest of the funding into after the positions was to work to do community facilitation and community engagement. And so that's really what our grant application looks like. And then we also built in some in-kind staff time, and then some commitments from the Department of Health if we're funded, that if there is additional needs for funding for a community facilitator, that kind of thing, we're going to chip in from the Department of Health on that. So again, we modeled our project off of Minnesota's Integrated Care for High-Risk Pregnancies initiative. We are, our real intent is to build off of and leverage current early childhood efforts and not duplicate them. And really, we are really wanting to fill that gap in integrating healthcare and the health system into existing efforts, while also building the infrastructure for an integrated model like iChirp. So I'm gonna close this down so I can see my full screen. This is sort of a visual of how we are proposing to go about doing that. And so we are, again, we're aiming for an equitable, family-centered, integrated early childhood model. And we're going to have a community advisory group that is really guiding how that model is developed and the work that is needed to get us there. The purpose of this funding is to really build the infrastructure so that at the end of the 5 years of the grant, we're ready to like take off and actually implement it. And so our goals, we have 5 goals for the project to help meet that, to help develop that model. And that is community-driven leadership, having a shared understanding and vision of the gaps in the system and where we need to focus our efforts. There is going to be a lot of work done around increasing our health system capacity, identifying financial and policy strategies to help make this work sustainable. And then inherent in all of that work is really advancing equity. So just some, I'm not going to go too much into it because if we're given the funding, we'll really be coming back and getting more feedback. But you know, some of the activities we want to do for each of the goals. So for that community-driven leadership, we're going to have an advisory council. We're going to have a facilitator who we're going to hire through probably a grant or a contract to help us really ensure that advisory council is facilitated adequately. And then we have some family consultants, as I said, that will really be providing leadership and guidance into the project. And then we'll have a lead position that we'll be hiring as well. Shared understanding and vision. Through the notice of funding, they want us to conduct a systems assessment and develop a strategic plan. The real goal of those is to not duplicate the work that's already been done. Like our preschool development grant, they did a lot of really good work to do a needs assessment. So, and then I'm at Department of Health and I primarily work in our Title V program. And we also did a pretty thorough needs assessment a couple years ago. So the real goal with that is to identify where there are gaps in our current assessments and then focus on those areas to maybe build a deeper understanding of where there are problems and issues and maybe get to the root cause of some of the things that are happening. Health system capacity. One thing we heard loud and clear, especially from our provider partners, is the bias and structural racism that is in our healthcare system that is impeding a lot of efforts to help achieve equity and to help get, you know, even just to help get more kids identified and into appropriate services. And so we really are interested in what the community has to say about that and how we should structure some efforts to help eliminate some of that bias and racism. But that is really kind of a central thing we're interested in working on. We would like to look into screening processes. Something that often happens in our state is we have a grant that's dedicated to improving screening. We see an increase in screening. And then what happens is when that grant is done, screening goes back down. And so we want to kind of like dig deeper into why that's happening and figure out how we can have that not happen. And then also really looking at where is duplication happening in screening and in just general early childhood efforts, and doing a better job to integrate the different early childhood things happening. Like for instance, we know that family home visitors are in the home and that they do a lot of things like weighing babies and that kind of thing. And then that's also happening at the doctor's office. And so we're interested in looking to, you know, create some more integration so that families can get the best care that they need in the right place for them. And then, like I said earlier, all of this work, in order to do anything, we're going to have to change some policies and financial structures in our state to be able to sustain a model like this. And then we do have a goal specifically around advancing equity, but I would say that the whole intent of the project is that. You know, we at the state have our triple aim of health equity that we're really trying to integrate into the project. And you know, that being that the community defines what is health to them, that they define what the solutions are, and you know, that we really get behind them in figuring out what efforts need to then happen. And that was a very quick overview of the application that we put in.
Great, thank you, Sarah. There is a question here. It sounds like you, I missed the piece that you mentioned personally, but Linda's actually asking the question about how early Head Start and family, friend, and neighbor care fit into this, the way you're thinking about the work for the state through this grant.
So I would see a lot of that falling into some of those integration goals that we have of, you know, we know screening is happening in a lot of areas. And so how could we make sure that we're taking that into consideration? I didn't go too in depth into that, but, you know, we basically in our application pitched some ideas that we have. And then we said, but these are our ideas, but we're going to have the community tell us actually what needs to happen. And so that I don't have necessarily specifics on how we see that integration happening. It's probably going to more so be based on what our advisory council sees the connections to be and where we should work. But we do know, and in talking to partners, you know, we heard a lot of Head Start and family, friend, neighbor care. You know, that may be where families are going rather than primary care. And so it's also, you know, but yet there are things that happen in a primary care well child visit that are not replaceable in other places. And so, you know, it may be fostering the connections and encouraging people to get into primary care, or it may be seeing where primary care can borrow from other people or other systems, that kind of thing.
Perfect. Great, thank you. Barty, you have your hand up. Why don't you go ahead?
Because I'm learning how to use the emojis. So thank you so much for the information, Sarah. In my former life, I used to work at United Way, and we worked on screening. I see you, Joe Munich. And so I'm really down like what happens when the investment is done, right? Like how the ongoing, you know, that kind of integrated sort of connection. And I know a lot of work has been done in Minneapolis public schools around this very issue and the partnership between the school district and the clinic around in clinics, and also in other places and in other partners, right? That can be faith communities, all those kinds of things. I'm curious about the connection between this work and the Center for Health Equity at MDH, because I think when we were working on Community Solutions Fund at CDF, you know, when we were doing that with Voices in CDF, I think it was really interesting to see how oftentimes how separate that kind of like that body of work was from like Title V and sort of some of that maternal child health. And so had been pushing, you know, who to be thinking about health equity in the context of maternal and child health. So I'm curious about that integration. And I know like that team has been wildly also redeployed in the context of the pandemic. Oh my God. But I'm curious about like how, you know, eventually, you know, fingers crossed, we're going to be done and folks can come back to sort of original assignments. And I'm curious about how, where that intersection or connection is with that.
So
with
we were able to get a little slice of time on Helen's calendar, who manages that. Yeah. You know, that the community solutions grants. And we, something I didn't show is sort of like a graphic that we have of a lot of the advisory groups that are happening in our state and how our project, what we're kind of hoping to do is pull people from the different advisory groups and or go to them and have a more back and forth so that we can communicate what we're doing to the Community Solutions Advisory Group and then the back and forth and see where there are areas for us to work together. You are right in that that program is still a little bit more siloed at MDH than we would hope it would be. And so I think the fact that the Preschool Development Grant has also contributed funding to them has helped with that. I do know that, and the person who Laura, our community or our Preschool Development Grant lead at MDH had helped us write this application as well, so that and she specifically, one of her tasks in this was to say to link it with the Preschool Development Grant and the Community Solutions grants. So I don't know that I have specifics for you, but I will say that we did have people reviewing it, specifically calling out areas where there's collaboration that needs to happen. And then we do plan to, like I said, we do plan to, the lead of this role will be participating and going back and forth to the other projects to make sure that there is that there's not duplication, but that we're all working together. Yeah.
Great, thank you, Sarah.
Yeah.
We have one last question and then we'll move on to Dr. Flynn, if that's all right with everybody. If you could share a little bit more about, Andrea is asking, how is the recruitment process going to happen for the community advisory group? And then also if you could speak a little bit about possible considerations and solutions for undocumented people and how to improve access to healthcare.
Yeah, so you know what? I don't really have a clear answer for the undocumented people. It is a population we talked about a little bit in the application, but that is a very good point, and it's not we didn't do a good job to integrate that, and so that is something that I'm going to. As I've been talking to people and people have been submitting feedback, I've been keeping track of a list of things, and so I'm going to add that to that list. For the community advisory group, so we're going to kind of beg and borrow from how iTrip did things, and so one of our first goals of the project is to get a grant in place with a community facilitator to really do a good to help us in the recruitment of the advisory group, I guess is what I'm trying to say. So we really want to work with someone, an organization that already has a connection with the community, and so that we can build off of that and leverage their connections that they already have. And so I'm sure we'll also use some of our typical means of recruitment, but we put some funding aside to have a facilitator to help us do a better job than we typically do at MDH of having a representative advisory group. So that's our plan there.
Well, that would be great. So thank you for adding that to the list of issues and concerns for a whole number of families in our state. So that would be wonderful. There is one last clarifying question. Jane sneaking in under the wire. I'm just teasing you, Jane. Jane, do you want to unmute and just make sure I'm clear about your intent? If you're asking for clarity.
Mostly I was just hearing Sarah say that some people prefer to take their kids to family friend and neighbor providers.
Yeah.
It's a different thing than what we're talking about, because it's grandparents that sometimes bring the kids to the primary care. or aunties or whomever. And that's what I think there's sometimes a challenge in that. So I just wanted to clarify that point.
That's a good point. And I was grouping them in with Head Start a little more than what I was thinking in my head when it came out. So
Yeah, that's okay. I just wanted to clarify.
Great. Glad you unmuted to clarify. So Sarah, thank you so very much for joining us this morning. I know it's not it's so common to come and talk about grant applications that come forward from the state, but I think it's a really helpful way for advocates and people in the field to better understand how the state is thinking about integration and working together across different systems, especially in this 0 to 3 space, right? So we know there's no one system that serves families. And so families reach out for healthcare or childcare or early learning opportunities and mental health services in a variety of different systems. And so it's really important that we stay connected, or that's what we've been talking about through this coalition, staying connected to the system. So we welcome the opportunity for you or somebody else to come back and share next steps. If the grant is made to Minnesota, we would love to help think through some of the implementation and who are some of the key stakeholders across the state. One of our greater Minnesota friends didn't speak up, but we have dire needs when it comes to maternal care in greater Minnesota. And so that is just really, really critical. I know our next speaker, Dr. Flynn, could speak to that as well. But anyway, we want to be here and supportive moving forward.
Great. And I have a couple direct messages that came to me. And so I'm going to jot those down and we will follow up with folks if we are given the funding for sure. I just wanted to acknowledge that I see them and I'm gonna take notes on them. So
great, thank you so very much. All right, well, we have our third guest that I get the honor of introducing as well. So Dr. Maren Flynn is with us. She's here today representing Minnesota ACOG, which is the American, it's OBGYNs, American Gynecological Association. It's the OBGYNs of the state of Minnesota. I can't even believe that as an MCH grad. I'm like, I can't even tell you the whole words or all the words for it. Anyway, we've asked Dr. Flynn to join us because ACOG has really been leading the way on the extension for the medical assistance coverage postpartum. And it's something that we've been talking about here through the Prenatal to 3 Coalition. And a whole number of people have signed on. We have 26 different statewide organizations now signing on to this bill. So we wanted Dr. Flynn to come talk a little bit about kind of what's going on, what they're seeing from their perspective, and then also making some connections because we're not as connected as we could be, and we want to maintain that going forward. So I will turn that over to you.
Thank you for inviting me and for the introduction. I agree, making more connections is really helpful for all of us achieving the goals of equity and better outcomes for everybody. So I'll start with kind of giving the history of the postpartum extension. We've typically defined the postpartum period as 6 weeks. And the thing to know is that's not based on any medical science, and it's not based on women's experiences of what they experience postpartum. It was an arbitrary designation. And when we've taken the steps of trying to understand what does a postpartum period actually look like and what are the needs of women, where we've settled out with the CDC and ACOG is that the postpartum period really extends at least 12 months and honestly, probably beyond. So right now our problem is that Medicaid only covers postpartum women up to 60 days after delivery. And so the purpose of the extension is to give women that full 12 months of coverage. Further history is preceding these efforts, ACOG was trying to work on understanding why the maternal mortality rate has been increasing in the United States. And we achieved that legislative goal to get committees funded to try to understand why that's happening. And one of the recommendations that the maternal mortality committees have been consistently making across the United States is to provide coverage for 12 months postpartum. specifically because we're seeing that a significant number of maternal deaths happen well beyond that 6 weeks postpartum. The deaths that are most significant for later on in the year are substance abuse, suicide, and specifically opioid related deaths. The other thing that I think everyone is well aware of is all of these inequalities in which moms are dying and which moms have poor outcomes after delivery are overrepresented in the BIPOC community. And Medicaid actually, as we all know, has overrepresentation of BIPOC women. And therefore, that's why our target has been Medicaid to try and increase access to good outcomes for women. Another goal is that this aligns the infant coverage of medical care with the maternal coverage. So infants born to women who are on Medicaid have 12 months of coverage. And so this aligns so moms and babies have the same amount of coverage. Some of the specific things postpartum that 12 months coverage would give women access to are, number one, dealing with postpartum complications that don't resolve in 6 weeks. So one of these specific things are pelvic floor dysfunction or healing from a perineal laceration, and that's not limited to a 6-week window. Often women have months of dysfunction that they need medical intervention for. The second thing is preventive care. Part of pregnancy is actually initiating preventive care, such as cervical cancer screening. And when we find an abnormality, 6 weeks postpartum is often too soon to do the intervention. For example, if somebody needs a procedure to remove part of their cervix to prevent cervical cancer, 6 weeks is too early to do that kind of procedure. And so the extension actually gives them access to that really life-saving.
Dr. Flynn is
Improve that care.
Oh, okay. You were paused for a minute.
Okay.
But you
Yeah,
look
sorry.
great. So maybe you could just back up 2 sentences.
Sorry, I'm
You did
my
pause
internet
for one of
connection.
those really odd shapes or so. All right. So if you could just back up 2 sentences and then we'll catch up with you.
So chronic conditions that are identified during pregnancy or worsen during pregnancy, again, don't have that 6-week time period that they need care. So these are sort of what I see as an OBGYN, the huge impact it can have on women. And then additionally that mom and baby dyad is, we know that the more that women are accessing healthcare, the more they're bringing their children to healthcare. So building on what Sarah's group is doing, that this is one avenue that actually helps bring children into preventive care, is giving women more access to care. Where we're at in the legislative picture at this point, the first thing to know is that with the CARES Act and the national COVID emergency, is no postpartum women can be kicked off Medicaid at this point. So right now, all women who are put on Medicaid for or qualified for Medicaid during their pregnancy are currently still covered. The second thing is over several years and many groups' involvement. This is not obviously not just ACOG, but really a lot of efforts from a lot of groups. It's looking really promising that this is going to pass in the Minnesota legislature. So what the legislation actually does is allows women who are on Medicaid for their pregnancy to extend it for the full year beyond their delivery. And it's currently passed through both committees in the House and the legislature, and it's looking promising that it will go to a floor vote. It's a bipartisan bill right now in the House, and it's Democrat only in the Senate, but at our committee meeting where they passed on the bill in the Senate, there was a lot of support from Republicans. So overall, this is looking like a very bipartisan bill, and it's looking promising. The third thing to know is at the federal level, with the American Recovery Act, is that what it's called, what just passed?
Rescue Plan. The
American Rescue Plan. So that actually does give a 5-year extension for states to opt into to give the 12 months postpartum coverage. So right now, if Minnesota passes this bill, we would get our same level of funding from the federal government to enact the 12 months postpartum expansion for 5 years, which is another really big movement forward to making this happen. I'll stop there for a second and find out if people have questions. And then, okay, the question about extending access to LARC is one of the really important things, because we know that women who choose the contraception that works for them tend to continue it. We also know that women who have optimal pregnancy spacing, that can help improve the outcomes for the next pregnancy and prevent preterm birth. And this would give women that full 12 months of unlimited coverage for long-acting reversible contraception. It does not fix the problem that we have of not getting funding for providing it at the time of delivery, but this would give women a bigger time frame for them to receive counseling about long-acting reversible contraception or the family planning they're interested in, and then enacting and choosing and initiating their contraception, and also giving them the time to change it if it's not working for them.
Great. Are there other questions? If not, I get to jump in with mine. I just want to make sure we are making some connection points here. So
Yeah.
one of the reasons, well, I should just say, we know that Senator Benson is actually supportive of this effort. She's very concerned, though, about the fiscal impact. And so with the American Rescue Plan, there is also an FMAP, which is the state share of the Medicaid cost. So they are covering some of the state share. And I want to say it's up to 85% for the first 5 years. So there will still be an impact. And so I think what they're trying to negotiate with DHS is what are the costs, because the state is going to have to update their software system to accommodate the change, because right now it changes it at the 60 days versus the year, and then the number of people that will be impacted by this. So those are some of the things that they're playing around with right now that I'm aware of.
And the numbers that the initial fiscal bill talked about was about 20% of women on Minnesota Medicaid right now are kicked off at the end of the 60 days postpartum. The remainder 80% qualify under the ACA expansion or have other qualifications for Medicaid. And their estimate was about 1,100 women per month would represent that 20% of women. And it looked like it was initially about $700 a month to fund each woman. So it is a cost. And I think we all agree here that's good use of money, and that's valuable money for the state to spend. And I am encouraged, because initially Senator Benson wanted to extend only to 6 months rather than to 12, specifically for those fiscal concerns. And she didn't offer that as an amendment. So right now it's passing through as 12 months.
Mm-hmm. I just put in the chat, there was a question about what are the file numbers. I put the sign-on letter that we've been circulating and working with ACOG on. It has both the House file number and the Senate file number in there. So you can just download that and take a peek. One of the things that I wanted to highlight, if I could, and it will, and might bring Barty into the conversation as well, with the Healthy Start Act that we talked about earlier with Safia. It was Barty actually in a meeting that you called up the important opportunity. So if the Healthy Start Act passes, we will also then be able to extend MA coverage and even have MA coverage for women who are in prison who move into these alternative settings. Right, Barty, you I don't want to take away the things that you highlighted, but I think that was a really important connection point for how we're trying to benefit moms and babies in these first few years. Do you want to speak to that a little bit more?
No, I just think that, as I think that I'll just be honest, I haven't seen as many maternal and child health bills go through the legislature as I have now. So I guess hooray pandemic for like making these things obvious. I don't know. I mean, these things were like ahead of time, but I do think that like, I also see that there is connective tissue between all of them. In the context of, what would 12-month extension postpartum do for women who are either in alternative placement vis-a-vis the Healthy Start Act, or who are just simply leaving, right, the justice system and how that moves forward. So I do think that is connective tissue. And when we talked to Safia about the bill before, because Stephanie Hoganson had, for those of us who are on the children's cabinet, had brought some folks together and some additional community folks. That was just, I think, one piece. So I think that, to the extent that, even as these bills move through the legislature, that there is connective tissue with other bills that are looking at maternal and child health, and how can we make like strong ties, that there's something here that can address, the disparities in health outcomes. But I think also, women need safe places to deliver and have babies. They need postpartum support. They need culturally specific support that honors like community in that kind of way. And these are all sort of moving through the legislature, and how can we, that I think that was mostly my, when we were talking to Safia, like, I mean, none of these are happening in isolation of the other things that are helping moms and kiddos.
And to just build on that, Senator Benson actually really agrees with you. She, for our committee hearing, she bundled several of the maternal child together, and the legislature is thinking of it that way as related legislature.
Benson is very energized, I think, by these bills, and that's exciting to see. So I think that's also why we're seeing some movement. So it's exciting.
Yeah. All right. Are there any other questions for Dr. Flynn?
I just have a question. Are there other things we can be doing? So we did the letter, but are there things that us as individuals we can do, like call or email our individual legislators? Is it time to do that now? Should we wait? Just wondering what it is we can be doing.
Dr. Flynn, do you want to take that one from your perspective, or do you want me to just loop it into or bring it into the broader conversation?
Am I back here? Sorry. Yeah. Okay. I got the beginning of your question, if there's anything else you can do. And I think any letters of support as individuals or organizations, especially if you have any ties to organizations or people that are out of the metro, but perhaps are in the rural districts or in Republican districts, that any of those letters of support are also really important. And again, I want to say thank you so much for the letters of support and the work you're doing to help with this legislation.
So maybe this question is to Laura. So I email my legislators in my region very often. Most of them are Republican. Is there something that I can be emailing, a message that I can be emailing directly to them? And is that time to do it now, or should it be later in the legislative process?
I think that's a great question. And I think, Nancy, if it's okay with you, I would like to use it as a segue into the next point of conversation, which was really to say, which is focused on, can we as a coalition start to not only get sign on, so we have 26 organizations who've signed on to this MA bill, which is, and these are statewide organizations, can we have some broad support for a package of maternal and child health bills that will help lay out, like, these are the key things that we think we need to see happen to improve birth outcomes for moms and for children, taking into consideration our personal, our goals through this coalition of racial, economic, and geographic inequities, really paying attention to those, and then see how broad of a coalition of people can support a number of these provisions, because one is important, right? So this is really a critical piece of the puzzle, but we want that puzzle. We want to help them make those connection points for them in some type of a package. That's what we wanted to discuss next. So, but I want to last call for Jane put in a great question here. Is there asking about long-term savings for these early investments? I don't have any at my fingertips. I'm sure I know that there is data available. I don't know, Dr. Flynn, if you have.
I didn't find any specific when I was kind of researching. I don't have any off the top of my head, but I can look further for that.
Yep, and we'll share that with everybody here then. Okay, and you are welcome to stay on if you would like. We had great discussion and dialogue, so maybe our agenda was a bit too ambitious, because now we have about 10 minutes left to talk about both a package as well as the goal of having a broader discussion about how we as advocates want to make ourselves available or position ourselves to support the implementation of all these federal funds that are coming forward. So the federal funds that are coming forward from the December haven't quite arrived in Minnesota. They're coming. The state agencies and the cabinet, children's cabinet, are thinking about how to make these resources available to families. However, the far majority of resources that come through government services to families come through systems, right? So there were some direct supports to families, but this is a lot of money that is going to come and try to help support families. What I believe to be true is that it's not always easy for families to access, even though everyone has good intentions around that. Actually accessing the resources still can feel challenging to families, especially when they're stressed, right? So this will require probably a much broader discussion, but I really do want us to be thinking about how can we help our state agencies, our counties, our cities, who will be getting some of these resources to implement, make it easier for families to find them, and or to, like, how do we want to help direct them so that we are actually making them more accessible. Okay, sorry, there's some things going on in the chat, but this time went fast. Oh, okay. Trying to keep up with all of these. So we have we have about 7 minutes left. I want to be respectful of people's time. I'm looking to my co-chairs, Barty and Nancy. I don't want to make this decision alone. How do we want to use these last few minutes?
Well, given there's been such a robust so much information about, I think, the issues of maternal child health in various ways and shapes, I guess one of the things, this is an area for which I think the Prenatal to 3 Coalition has been talking about. It's part of our policy priorities. So I guess the question I'm just thinking about, like, in the next 7 minutes, like, given what we heard today, are there any places or spaces we would like to lean into? How would we as a coalition like to think about how we could support some of these efforts? We have done some of that before. So I think that brings us to Nancy's point. And I think maybe, Laura, we can also put a pin in, since the Recovery Act rescue plan just passed this week, I think we could maybe put in a pin in that into the next meeting. But I'm curious about, like, based on what folks heard today, how do we think that the coalition can really support these efforts? Because I don't think I've seen this much in the way of maternal child health supports in a long, with so much energy right? So I'm curious about where the coalition thinks it can sort of like lean into that right now.
I would agree with Barty, and just, like, what can we do, not only as a PN3 coalition, not only our organizations, but also, like personally, what can we be doing to really push this? Because this is really exciting, and it's such a great opportunity that, like Barty said, we haven't had for a while. So that's what I would also like to talk about.
Laura, thanks for putting the list in the chat. So these are some of the additional things that are happening. And like I said, this is a lot of energy here. So I'm curious what folks think about how we might lean in. And some of you are actively working on these pieces yourselves. So I invite you to be directive in your recommendation.
So as you're thinking about it, one of the things that I think might be helpful for us, because we are providing this cross section, right, for these for maternal and child health issues, is do we think we can lean in and put together a letter of support for a variety of maternal and child health bills and help the legislature? Probably the most important thing is whether or not we are supporting these specific bills, but maybe helping them understand how all these pieces fit into the greater picture of that puzzle, right? Because I have heard now from Senator Benson, and I've heard from Representative Liebling, they don't understand like how they're all connected, and everybody is coming forward saying it's helping address our inequities, it's helping address our inequities, and they're just not sure which of them are most important and where are the levers, right? So I think in public policy, we're also looking for those important levers of, if we do this, it'll make a change here and here and here. And so where do we pull those levers, knowing that there's cost associated with each of these? And then also being really trying to be transparent about how the federal rescue plan might help inform that, support that.
I think we not only need to look at how it's going to inform that, but also what the impacts are of it, because we're hearing from some state legislators that, well, why should we put state money into this when we're getting this huge influx of federal funding? So we also have to be really aware of how we message that and how legislators are thinking about that.
Mm-hmm. So I do see a few comments with agreement that some type of a letter helping make those connections would be useful. The good news is we have started our broad messaging around these issues with our brochures that we have available, and we have these phenomenal fact sheets on American Indian infants and toddlers, and we have county specific data available too that we can direct people to and use. But having individual calls, to your point earlier, Nancy, to your own legislators is really helpful. And I think it would be helpful for us to come up with that list of a package that we think is critical with bills that are going forward, and get that out to everybody to take an opportunity to look at and comment on.
I was just wondering about early Head Start. There are a couple of bills, one that, and that there was a discussion at yesterday's hearing of Pintos regarding, are the poor families going to not be poor anymore? And the fact is that many of the the American Rescue Plan will be for working families with tax cuts. And if you don't have an income, you won't get some of those benefits. So I think I put in FAQs from legislators that is there a place that we can have a resource to go to that lists the bills? What's the status? is that where West Central might have a website, or is that where Children's Defense Fund might? But it would be nice to be able to tap into that.
As Ann,
And Ann, I see you can use your bill tracker.
yeah,
Okay, I'll be quiet
I
now.
would say Ann does a fabulous job of the bill tracker, so I don't know that we want to necessarily replicate what she's already done. And if you go on to the child care, you go to Child Care Aware of Minnesota bill tracker. If you Google that, it'll come right up.
What I will do
specific bill tracking on the maternal and child health. Because Anne, are you tracking those pieces? Yes, no, Anne?
yes.
Yes.
She said
awesome.
Yes. So
Well,
I will work with Anne and grab some of we've been tracking some of the bills as well. We just haven't been posting them on our website. So we've been trying to track them and make them available. What I would ask is if you have other ideas to bills or suggestions of different policies or bills that are moving forward, please add them to the chat. I will try to put together next week because we're going to be hitting deadlines, right? So as we start to see conference committees moving forward, I think that's when we really want to position our letter and do some outreach specifically to the committees that will be hearing these bills. But we want to get this information to you before our April meeting, because we'll be asking you to make meetings or set up phone calls with legislators if you're able to do so.
Jane, I think what you highlight is, I think, some general confusion about the legislature and about like the money that's coming in. The state is still trying to work on how they spend the December stimulus, much less the American Rescue Plan, right? And I will also say, I too have heard from several people, I think there's confusion about the child tax credit, right? Which actually expanded eligibility to even people who don't have income, right? So that actually supports an additional 26 million children across the country. I guess all I would just say is, I think Anne made a really excellent point here in the chat about, that I think that there is some sussing out between what is going to be supported by the feds and where the state is. We are fortunately in a better position. The state was forecasted to have a surplus. Hooray. I think that speaks to the uneven recovery of like some people are really doing well and some people are really not, right? And then I think also the federal resources that are coming. So I think part of that is just like messaging that they can't take their eyes off of it. Suddenly, like, you don't get a free pass now because you think some federal money is coming. And I also think just sort of sussing out some of those pieces. So I'm right there with you, Anne, and here in the chat for sure.
And I did find both my camera and my mute button. Sorry, I'm actually working on the legislative bill tracker as we're talking. I apologize. But so first of all, if there's anything you feel is missing, Laura, or others, I can add it. I have added a few. And I'm putting them in order now of what made first deadline, which is an amazing number, by the way. The vast majority of the bills have been introduced. It's been quite the year so far. But yeah, Marty, I was just thinking there's so many things, and we're running into it certainly on the childcare front too, in terms of there's this sense that it'll be, what I've tried to point out is first of all, we don't know what the portion that is for the stabilization grant is even meant to exactly do. But if you look at how much we've been spending just on the support funds, that's 50 and 60 million a time, and it's got something like 350 million we're getting. So it's a lot, but on the other hand, it's not a lot depending on how it gets used. And so we still want to see state investment, and then, it's going to be gone. So I really hope this doesn't become an out on all of these fronts for the legislature to say, well, then we just don't need to do anything on the state level, because one more biennium and we'll be back where we are right now. So.
And this is Frank. Thanks for doing all that tracking, and I'll connect with you offline, but I'm just thinking of a couple of audiences that I'll be working with in the next 2 weeks, in addition to legislators. For example, Itasca business leaders, and they'll want some easy way for me to demonstrate to them kind of what's the summary of impact, et cetera, et cetera. And then I like where you're going in terms of talking points. I'd like to get them on that point as well, but they'll need a little summary and data from which to build off of. So thanks for moving us in the right direction. I'll circle back if I have questions.
Well, sure. And I think it's something we all need to co-create, frankly, because we're all getting little bits and pieces of information from our national organizations, but it's still a little unclear what all is going to be included. So it's work we probably should do together. Yeah.
And they're still unearthing. It's a huge piece of legislation. Like digging, digging a ditch here. You're really trying to get in there. So for sure.
All right, I thank you. We are at time, right? So I just want to make sure I put in the chat. We are hosting a meeting on Monday, the 15th, with state staff to talk about the federal infusion of funding from December and how we can try to support family, friend, and neighbor care with those federal funds. I'm sure it will. The recommendations that we move forward will be consistent with any new funding coming forward as well. But we just really want the state to be thinking about investments in family, friend, and neighbor care. So if you're telling me to add you in the chat, please make sure I have your email correct. And you can add it there. I will work with our co-chairs to get a letter out to people that will that we can send out to the legislature, but we'll send it out to you sometime next week for review and comment around messaging. All right. Thank you, everybody. Have a great day and enjoy tomorrow's weather.